Welcome. Welcome back at 7:14. As we head into the fall, now is the time to start scheduling our annual flu and COVID-19 vaccines. Now, there are some things you need to know about the shots this year. Touro primary care physician Dr. Schuyler Williams is here to discuss. Dr. Williams, good morning. We appreciate you joining us.
Hey, good morning. Thanks for having me.
So let's start off with this new COVID-19 vaccine. What is new about the shot and what do people need to know?
Yes, COVID-19, the virus continues to circulate in our community. And so what we have done this year is updated the vaccine to target the most dominant strain of the virus that is currently circulating in the United States. With this updated vaccine, we are hoping to protect large numbers of people from the virus, as well as prevent your risk of serious illness related to COVID-19 infection. And it will be the only COVID-19 vaccine available this fall.
But you were telling me in commercial break, waiting for pharmacies across the country to get it in stock. And then as soon as it's available, you're encouraging people to go ahead and get it.
Yes, absolutely. This new updated vaccine is recommended for all individuals aged 5 years and older. It is a single dose, and you should receive it at least 2 months after your previous COVID-19 dose. For children under the age of 5, the vaccine is also recommended, but the number of vaccinations depends on which vaccine your child has received and their age. So it's important to talk with your pediatrician about the vaccine for anyone under the age of 5.
And Dr. Williams, we're hearing a lot of healthcare professionals encourage people to get their flu shots right now. I know the RSV shot is also available for some age groups as well. Is it safe to get all of these shots at the same time? Should you maybe hold off one for the other? Can you get two together? What combination is safe, if any at all?
Yeah. Studies have shown that it is entirely safe to receive both the flu vaccine and the COVID-19 vaccine at the same time. The new RSV vaccine has not been studied being co-administered with the other vaccinations. Hopefully in the next few months we'll get more data about the safety of co-administering it with other vaccinations, but it was one I would recommend getting independently at this time. I guess I should mention that RSV vaccine is a new vaccine this year for adults age 60 and over. It is targeting a respiratory syncytial virus. That's what RSV stands for, which is a common virus that kids frequently battle with in the winter months, but it can also cause serious illness in older adults as well. And that's why a new vaccine has been created for adults age 60 and over.
So for older adults who want to get their COVID-19 and flu vaccine, they can get those together, but how long would you recommend they wait if they want to also get that RSV vaccine? How much space should they put between those shots?
Yeah, I would say enlist a priority of vaccinations to receive right now. I would say first would be to get the COVID-19 vaccine as soon as it's available, because that remains the virus that is circulating at highest rates in our community. Next would be the influenza vaccine. Receiving those both at the same time, as we discussed, is totally safe to do. Following that, I would look into getting the RSV vaccine and probably waiting 2 weeks in between getting those immunizations.
All right. Well, Dr. Williams, thank you so much for clarifying some of that stuff for us. We appreciate you.
Yeah, anytime. Thanks for having me.